Dr. Ali, you mentioned extensive treatments. What do you mean by extensive dental treatments?
So sometimes without prior x-rays, because of the inability of a patient to sit through that, we're faced with having to sedate someone and then take the x-rays and do our examination. Sometimes, they just require a cleaning and a filling, but older patients that have been away from dental practices for a couple decades sometimes could have pretty extensive treatment that includes fillings, deep cleanings, crowns, having to do a root canal on the tooth because of the extent of the cavity, sometimes extractions, wisdom teeth that need to come out. And one thing about that is, with poor conditions, and this is the beauty of our practice, sometimes you can't do everything in one day because first you have to control the infections in the mouth. That means getting patient out of pain and infection free. So we have to initiate root canals, do extractions. So the first appointment is usually to stabilize the mouth, followed by some time and oral hygiene instructions to the caregivers, to the families, to the patient on how to maintain better oral health. So the second appointment that we do, things are in better shape. We're able to take molds for crowns, place implants. So sometimes it's not because of our inability to complete the work, but because of the condition of the mouth, we're unable to do everything at once. Those are the extensive treatments. And the beauty of our practice, we can phase out whether it's for the condition of the mouth, or sometimes it's financial, sometimes it's timing, patients travel. So we are able to split up the treatment to accomplish the best results. Most places are unable to do that because they work with a third-party anesthesia provider, and it causes a difficulty in scheduling multiple appointments. Some of these appointments are short appointments. You can't really get an anesthesia provider to bring all their equipment, medications to your practice and treat a patient for 30 minutes. It's just not the way it works. But with our facility, that is not an issue. We are able to shorten appointments, lengthen appointments according to patients' needs.